Welcome to IMD's Thought Leadership interview series. We will speak about three aspects of resilience: leadership resilience, strategic resilience, and systematic resilience. John, thank you very much for being here today with us. Let me just ask for a quick overview on where Zurich Pharma stands now, today.
Towards the end of January, when the COVID-19 virus first became known, obviously our business continuity plan, our BCP as we call it, was focused very much on internal issues relating to employee safety. We were cutting back travel, of course. That shifted dramatically through February into March when the COVID-19 was declared a global pandemic, and of course it started to affect intensely our external market environment. So at this stage we jumped into action with a much more ramped up business continuity program. And since then, we've been full on maintaining the supply chain of medicines to all of our markets and all of our customers, which really is the key priority for us.
And in this COVID-19 crisis, how have you led Zurich Pharma on an organizational level so that you would not only make sure that you survive, but only that you come out of the crisis with momentum?
We're used to different crises. To a large degree, we build resilience into our organization and into our systems and into our supply chains. As a distribution company in the healthcare space, we can't afford to step down. We have to keep supplying, we have to keep delivering. And if we ever stop doing that, we would no longer be true to our mission of making healthcare accessible. In terms of my leadership, it's to really maintain a focus of our entire organization on that mission of making healthcare more accessible, of maintaining an open and transparent communication with our clients, the pharma suppliers who are keeping the supply of their products to us whole, and then also with our customers and other business partners.
What has made Zurich Pharma business model robust to withstand the enormous changes that happened in the external environment?
Firstly, a very robust business continuity plan that's well drilled. Secondly, a resilient supply chain that we've, to a large degree, worked very hard to risk-proof. And thirdly, just great people. So I'm very proud of the team, and I'm very proud of the fact that Zurich Pharma is still operating in all our countries really pretty smoothly despite the circumstances.
Can you tell us, please, about the transformation of the business model that you put in place, moving from traditional pharma wholesaler to a modern, data-driven healthcare service provider?
What we've been able to do in the last 5 or 6 years is reinvent different parts of the business. We've built a new commercialization division, and we've also built a completely new division called Care Connect, which is a third-party administration business administering for what is now 14 million members across Asia, the insurance claims and the healthcare needs of individuals. And this investment into these two different divisions, I think, is now putting us in a position where we have three quite strong legs to our business, not just one. And the chances of being marginalized or commoditized are now much more remote. And on the technology side, we've invested hundreds of millions of dollars in upgrading our ERP systems across 13 countries. The fact that we're able to talk to all of our companies around the space, to talk to all of our 350,000 customers, to talk to all of our 400 clients and business partners, we're in a position to standardize everything, to have a very clear framework, and to be able to operate from that a much tighter control and transparency and balance across the supply chain. And this has been transformational for the company.
And I suppose this has also led to rethinking the organizational structure of the company.
We've built a regional functional organization in some key areas, in quality assurance, in operations, in technology. But at the same time, we preserved nationally, locally, the autonomy and the important authority, if you like, of the general manager. So it's balancing those two things, the central and the decentralized in-market companies, I think, is the key to our success.
Was Zurich Pharma able to identify some COVID-19 related opportunities and to seize them?
One of the opportunities we've observed, the silver lining, if you like, on that very black cloud, has been to roll out and accelerate our EasyRx e-commerce platform, which is online ordering and cash collection. I think another big silver lining has been the proximity we've been able to generate with our clients, bring us into a much more of a strategic partnership, not just a cost center transaction, as it were.
Thank you very much.
John, the COVID-19 crisis really tested the healthcare systems around the planet. What lessons can we draw from this crisis, and how can the system, the healthcare system, become more resilient?
I think one of the learnings is governments, societies need to take science and medical science much more seriously. The Ministry of Health needs more teeth, needs more say, needs more control over these kinds of situations so that we in the industry can actually work with them and react with them. And I think in many respects, this government-private public partnership between different members of the ecosystem is going to be crucial in the future if these kinds of situations are going to be managed more effectively.
Do you see the requirement for more integrators in the healthcare system, more connecting partners?
This is one of the reasons as a company that we have decided to invest in the third-party administration space. This is our opportunity to help the insurer, the payer, collaborate with the government, with our client base, and with doctors to make sure that whatever healthcare is provided is done so in the most efficient way possible.
So in this striving for more healthcare efficiency or effectivity, if you want, how much does data transparency help?
I think data transfer and data sharing and standardization and opening up of systems is going to revolutionize the way doctors can manage patients. We need to see a more efficient response that provides healthcare for all and not just healthcare for the wealthy or those fortunate to know a good doctor.
And there's also, I think, an opportunity of new business models based on these data.
We're incredibly careful to operate within the data privacy laws that exist in every country, but there are opportunities to create real-world evidence on an anonymous, non-named patient basis, and we're in the process of figuring out how best to make it available to different members of the healthcare society and to government. On the flip side, the client data we have, the shipment data into market, the offtake data, these really are revolutionizing how we interact with our clients, because our clients now look to us for a lot more than just someone to stash the boxes and collect the cash.
John, thank you very much for this insightful interview. Take good care. Stay safe and healthy. Thank you very much.
Thank you, John.
Thank you. All the best.